2023 Employee Benefits Program offered by NewGen Holdings to all its full-time eligible employees offers a broad range of benefits from which employees will pick the plans that best meet their needs and the needs of their eligible family members. NewGen Holdings utilizes Blue Cross Blue Shield of Arizona to provide 5 options, including 4 traditional PPO plans, a qualified high-deductible health plan, all that use the same national PPO network out of this Arizona-based plan. MetLife offers the life insurance programs, dental, vision plans, and 2 disability insurance plans. NewGen Holdings uses EASE for the online enrollment benefits platform. This paperless environment allows employees to enroll in the program as initially eligible employees and also during the annual open enrollment period in December each year. This open enrollment is for the plan's anniversary date each January. Note that medical, dental, and vision premiums are taken from your pay on a pre-tax basis if elected. This program saves money on premiums that you pay for these plans, but it also requires a qualifying event during the year if you wish to make changes like marriage, birth, or a loss of a coverage plan. Remember, this is an Arizona-based policy. NewGen Holdings uses Blue Cross Blue Shield of Arizona. All employees are covered by this plan, and you'll look up providers nationally under this plan, which uses the Blue Card feature to access networks around the country. First, talk about the life insurance program. NewGen Holdings provides each eligible employee at your initial enrollment with a group term life insurance policy of $20,000. This life insurance is provided to you at no cost. Please make sure you name a beneficiary for the coverage while you're in the enrollment system going through the enrollment process. You may also elect to take optional or voluntary life if you want to add life insurance to this basic amount. If an employee elects coverage, they can also elect it on their spouse and any eligible dependent children. Note that if you do elect voluntary life, the deductions there are taken on a post-tax basis so that the benefits, if payable, are tax-free to a beneficiary. MetLife is also the carrier for the dental plan options. The company provides a low-cost plan and a high-cost plan. The differences in these 2 dental programs is that the low-cost plan has a little bit higher deductible, a $50 calendar year deductible to be specific, and a lower maximum at $1,500 for maximum benefit payable to each insured person. The high plan has a lower deductible of $25 per calendar year if needed and provides a $2,000 annual benefit maximum. These plans do have a lot of similarities, however. Both plans have a rollover feature. If you seek out your wellness exam and don't use all your maximum, some of it will roll over into subsequent years. Each plan covers 2 preventative exams for teeth cleanings at no cost. As long as you're using a MetLife dentist, your preventative exams will be covered at 100% with no deductible. Both plans also cover basic and major services, such as cavities being filled, dentures, and implants. They're both covered at the same percentages under these 2 dental plan options. The vision plan, provided again through MetLife, uses the Davis PPO network. When you pay a $10 annual exam at an in-network provider, you'll get your eyes checked and get a prescription. From there, you get a $150 allowance to spend on glasses or contacts after you've paid a materials copay under this plan. All the benefits are available to you each year. Looking up dental and vision care providers, you want to make sure you go to the MetLife site at metlife.com. You want to select register under My Benefits, and as soon as you type in part of the employer's name, NewGen Holdings, a drop-down box will give you that selection. Click on that, create your profile, and you'll have access to an individual member portal that knows your plans and your network. You'll simply type in the type of provider you need, a zip code, and it'll pull a list of providers that are close to you. Once you pick a dentist, you simply call and make an appointment. MetLife does not issue an ID card, so you'll want to make sure you're using in-network dentists. And if you don't register at My Benefits, please note that you have the PDP Plus network for your PPO in-network providers. The MetLife Vision Plan, as a reminder, uses Davis Vision PPO network, and if you register, you can see those very conveniently, or you can call 855-MET-I1. largest employee benefits program provided by NewGen Holdings. The first is a short-term disability plan. If you're unable to work and under a doctor's care for injury or illness, the plan will pay you income after the 7th day that you're unable to work. The plan pays up to $1,500 a week as long as that doesn't exceed 60% of your income, and will pay you for up to 6 months as long as you're under a doctor's care verifying that you can't work based on an illness or an injury. Remember that your employer pays for this. Please don't forget you have coverage for a disability in case you're off work more than 7 days for either an injury that happens off the job or an illness. The long-term plan is one that employees will elect to take and pay for themselves. If you want coverage for your income and protection after that first 6 months, if you remain disabled, this plan will cover $8,000 a month, as long as that doesn't exceed 60% of your earnings, and will pay you to age 65 or your Social Security normal retirement age. Remember, all that's needed is that you're under the care of a physician who's verifying that you're unable to perform the normal duties of your job. It covers all off-the-job injuries and illnesses. Workers' comp will cover anything that occurs to you while on the job. Let's take a look at the 5 medical plan options available from Blue Cross Blue Shield of Arizona. Employees will pick the plan that best meets their needs, and as you can see, there's a variety of deductibles so that you have a variety of costs associated with these plans. The PPO plans are traditional PPO plans, meaning that they have office visit copays, urgent care copays, prescription copays, and even emergency room copays in some cases. These are traditional plans that protect your cash flow by providing copays and 100% coverage for the services after the copay is met. The plan's deductibles apply to surgeries or hospitalizations and some high-dollar diagnostic tests. The high deductible health plan discounts the services as it's covering the same things, but applies them to the plan deductible first. It doesn't have copays like the PPO plan does, but it does pay 100% of all your eligible expenses for the balance of a calendar year once your out-of-pocket maximum is met. The benefit of the high deductible health plan is that you get to open a health savings account and deposit money tax-free and spend it tax-free as long as you spend it appropriately to help self-fund the front end of your plan deductible with tax-free dollars. When making a selection, remember that all 5 plans have unlimited benefit maximums. No plan has a limit to what it would pay. They all use the same PPO network under the Blue Cross Blue Shield of Arizona plan, which uses the Blue Card feature to access Blue Cross national networks across the country. All plans are open access, meaning you can self-refer to a specialist without seeking that referral from your primary care physician. They cover the same conditions and services. You're not going to find that a plan covers one condition or treatment plan and not covered by another plan. The differences in these plans is the cost sharing. So please refer to your benefits brochure or the plan summaries that are provided during open enrollment for details. One special feature of the high deductible health plan, if selected, is that it covers a whole host of maintenance medications at 100%. The deductible doesn't apply, and these major drugs in 14 major categories are covered at 100%. Again, no deductible. There's over 500 listed prescribed medications, so big benefit to that plan. The list is fairly large. The PPO plans do cover some maintenance medications, but not nearly as many as the high deductible health plan. If you do elect the high deductible health plan, you'll automatically have a health savings account open for you with Health Equity Bank. This is the sponsored bank of NewGen Holdings. You'll receive a debit Visa card from that bank as soon as you've enrolled and your bank account is active and open. You can spend this money on the medical deductible, obviously, and any out-of-pocket expenses that you might experience under that plan. You can also use it tax-free for dental and vision. And you can spend the money on an immediate family member for their out-of-pocket expenses, even if they're not covered by your high deductible health plan here at NewGen Holdings. The IRS does set limits. You can see here that anyone with single coverage in 2023 can put in $3,850 in that account, tax-free. You don't have to put that much, but that's the maximum amount. Any amounts under that are certainly tax-free, and you just deposit as much as you can afford out of each paycheck. Family coverage, which is employee spouse, employee children, and full family, can deposit $7,750 in 2023. If you're over age 55 and joining this plan, you can deposit another $1,000 in addition to the amounts reflected here. It's very important to use network providers when using the medical plan. azblue.com, the Arizona Blue Cross plan, provides a way to register for MyBlue. This way, the site knows your plan, it knows your network, and you can more easily and conveniently look up providers, order ID cards, and look at your claims information if necessary. You also have a couple of applications that you can download on your phone. The MyBlue app provides you the same access while on the go using your mobile phone. You can also download the Blue Care Anywhere app. This allows you to access the plan's virtual office visit feature for lots of primary care office visits. If you just need a prescription, you don't feel good, they can order that and send it to the local pharmacy for you to have picked up or delivered. Please download these apps at Google Play or the App Store so that you have access to your health plan while you're on the go. And one more reminder, please note that we really do use the Blue Cross Blue Shield of Arizona plan. Even employees outside the state of Arizona use this carrier and access their PPO networks through this site using the Blue Card feature that's provided under this plan. NewGen Holdings uses EASE for its online enrollment process. Now, while you're an initial employee, you'll elect benefits in this site, and then annually during the open enrollment periods, as I mentioned. You'll get an email after your onboarding is complete from the EASE site. Click on this link in the email. Create and correct your personal profile and make sure all that information is correct. Add your dependents and any named beneficiaries you'd like to name in this system. And then you'll waive or enroll the benefits just like I've described them here today. Once you're done, it'll show you a summary of the plans you've picked, the dependents you've covered, if any, and the cost associated with the insurance plans you've elected during the EASE enrollment activities. Please sign the forms and click Finish so that the data can be extracted and uploaded into the system and fed over to the carrier so that your ID cards can be ordered. Please look for the EASE email and make sure you've got your dependent and beneficiary information when you go online. It'll make the enrollment process much easier. It should only take about 10 minutes if you got that information handy in advance. So what are the next steps? Just look for that email from EASE. If you don't get it, contact your HR director or call one of our advisors. Their information is listed on the brochure. Please check your profile information for accuracy. Make sure the address is correct, for instance. And you'll want to go through and waive or elect each benefit in EASE. If you waive now, remember, you can add coverage at a later date. A summary at the end will show you your cost. And if you have questions, you'll want to contact one of our benefits advisors. Steve Reese and Joanna Moreno are available. Now that you're an employee of NewGen, you can get their advice on insurance selections, questions about coverage at all that's offered under this program, questions about EASE or getting some kind of assistance or troubleshooting with the system is also available through these benefit advisors. You can text, call, or email, and they'll set up a convenient time to discuss your questions and provide you with assistance. Thank you for listening to this presentation of the NewGen Holdings Benefits Plan. Please do not hesitate to contact us, and thank you for taking some time today.